Hey, Sydney.
Hello, how are you?
I'm good. I was just talking to the group out here, and it's been good. I said, you know what? Instagram, technology, we're in the age of craziness. Sometimes we just got to do it again. But someone did say, thank you so much for redoing this. So I think that
Yay.
I think this is going to be good.
Good, good. Yeah, we're so happy to redo this and like so sad.
I know,
Our
right?
first one got lost.
I was telling everyone how like I was trying to upload it and it was like that little last upload, it wouldn't upload. Then all of a sudden it was like, someone told me to go to my archives and I tried to process it, then it deleted. It is what it is. We're here now. So let's get it started. So thank you so much, Sydney, for finding this time again. Everyone else, thank you so much for being here. We are going to do a redo. So those of you who don't know me, I'm a special educator. I am not an adult with dyslexia, but I'm very passionate about fighting for the cause. And I'm always here on this platform to give you new content, to interview experts in the field. Sydney is an amazing resource. I'm so excited for this interview because I want to hear these answers again. So Sydney, can you please introduce yourself for the audience out there?
Yeah, so I'm Sydney. I am a pediatric speech language pathologist. So I primarily work with children from birth to 18. I specialize in working with children who are deaf and hard of hearing, but also with kids that have reading disorders and dyslexia. And how I kind of got into the reading disorders and dyslexia is my brother is a dyslexic. I am not dyslexic, but my brother is. And so it's really close to near and dear to my heart.
Near and dear, and I love that. And I know a lot of folks always like to know the context, which is why I always start off by saying I'm not an adult with dyslexia, but I started off my career in a private dyslexic school, so that's where my passion came from. But right now we're focusing on you. So those of you out there, I don't know how much you know about what an SLP does, but it's always good to touch on that. So Sydney, if you can really touch on the different specialities, there we go. Ooh, it's 7:30. Of what a speech language pathologist does. Let us know.
Yeah, absolutely. So the field of speech language pathology is extremely broad. And I don't think that most people understand that concept is that we're not always working with children and we don't always work in pediatrics or in school settings, but you can really work across the lifespan. So starting like early on, a lot of people work in early intervention, and that's primarily like in the home therapy that people do, or they might do it in a clinic setting. Then you kind of move into private practices or preschool settings where you also might see an SLP kind of doing some of that similar work of early interventionists, working on language, working on building social skills, maybe some articulation. Then we can move into the school setting. Schools is definitely looking at that academic impact that people might have in relation to like their speech language communication deficits that they're experiencing. There are SLPs in the school that see kids from that preschool age all the way through high school.
Okay.
Then moving into like more adult centered, you still have those that might work in private practice areas, but then you also have adults that work in skilled nursing facilities, and you also can have them work in acute inpatient hospitals. That's for pediatrics or adults, for people that have had traumatic brain injuries, who've had accidents.
Like strokes, right?
Strokes is a very, very big one. I don't think people also know, like sometimes if someone's had a heart attack, an SLP might be consulted for that too, because one of the nerves that innervates our swallow is kind of wrapped around the aorta. So when things happen,
no way.
you might need an SLP. So like I said, I mean, the range is
It's a wide range.
Wide open.
And so I really appreciate you giving that breadth of knowledge about what you all do in the field. And so for me personally, I know I've talked to you about this. The only thing I really knew about an SLP was the school setting. And someone actually just asked, the relatable teacher, which she's fantastic, do SLPs need to be certified like teachers to work in schools? I'm assuming yes, but can you answer that?
So it depends on states. And that
Okay.
is like interesting. So I was listening to a podcast not long ago, and it talked about how in the state of Florida, you can work up to 7 years as an SLP with just your bachelor's, as long as like you're working towards your master's degree. Some states have it to where you can work as an SLP in the schools with no master's, just your bachelor's. And then your credentialing agency would depend based on what you're going for. The majority, though, of speech language pathologists do have a master's degree in speech, language, and hearing sciences and communication disorders. After that, the majority of SLPs hold what's called CCC, or the clinical, oh my goodness, certificate of clinical competence. Woo, there we go.
No, thank you for that. Because I would always see CCC and I was like, what are all these letters after their name? What is this?
Yes. Yeah. So it's the certificate of clinical competence. And so after working for 9 months to a year, completing X amount of hours in mentorship, a SLP can apply for that through ASHA, which is the American Speech Hearing Association. And then they are like credentialing body for that, and you can be awarded your Cs. So, like I said, wide variety, but most people have their masters, and most people also have what we call their Cs.
So I love the fact, like, honestly, Sydney, this live is more popping than the last one we did. Like, we are getting engagement. Hello to everyone who just joined. I am so excited to have this conversation again. Maybe this is a better time for us to do a live, Sydney. I mean, I feel a little recharged, even though I feel like I'm tired, but this is so good. So can you actually share, what exactly do you do? What does a pediatric SLP do, and what kind of patients do you see?
Awesome. So with pediatrics, you can see all kinds of different things. You can see cognition, executive functioning, language processing, dyslexia, literacy-based interventions, articulation, early language, fluency, voice disorders. I mean, when I say like you really can see a lot of different things, you can. What I do, and where my passions kind of lie, is working with children who are deaf and hard of hearing. That is like my bread and butter. And so the majority of my patients, I always get asked this question. They, most of them do not sign. Their families have chosen for them to use listening and spoken language. So even though they are clinically deaf or hard of hearing, the majority of my patients use hearing aids or cochlear implants to communicate, like for sound, so that they're able to communicate in that way. And then I also work a lot with older kids with language processing, comprehension, writing, decoding, reading, words, spelling.
That's awesome. So let's actually transition to how that connects to dyslexia. So specifically for you, I know that we've talked about structured literacy in our personal chats, but can you share a little bit about what kind of interventions you put in place as an SLP for some of your patients that are dyslexic?
Yeah, that's a really, really good question. So I think the first thing is we do know that there are early signs of dyslexia, right? So speech sound disorders is definitely one, and also delayed language is another one. As far as trends is what we see when people are diagnosed with dyslexia as they get older. So with that, like kind of can cue for an SLP are things to kind of work on and concepts to work on before kids even get to like that pre-K kindergarten stage. I always think of like oral language as one, but also print knowledge, right? Like working on print knowledge, working on like the mechanisms of a book, like the parts of a book. This is a cover, this is a title, we turn the page, we read from left to right, we go from top to bottom. Those kinds of things are all super important, and what I work on when I'm working with my patients as far as like the little ones. And I also do that a lot with children with hearing loss, because a lot of them tend to have difficulty with the process of reading and phonological awareness. So that's the other thing that I really work on too, is phonological awareness. You know, building that skill, that foundational skill, working on that early on is super, super helpful. Then moving into like my older kids, these kids that have, you know, they have gotten some instruction, they're clearly still struggling, they probably have a diagnosis of dyslexia, using structured literacy programs. So specifically for me, I was trained in Linda Mood Bell, and I've also had training in Wilson Reading systems. So I've been trained in both of those programs, and they're nice because they're kind of structured for you. You don't have to necessarily like think of the materials, but also being a therapist, I don't just go based on what these programs have prescribed. I use my clinical judgment and discernment to realize what other things kids might need to target and work on. But I definitely say that they give a really strong foundation.
I love the fact that you actually talked about your Linda Mood Bell training and how you like how it's a program, but you're also being diagnostic and prescriptive, which is very much Orton Gillingham too. We don't just say, oh, here's this, we tailor it to the student. And I think, as we know, as well, you're more of a clinician, I'm a special educator, but we know in the field, you've met one dyslexic, you've met one dyslexic. You know, you can't just take this one thing and apply it to every single dyslexic child that you are working with. I have to do a little commercial break, Sydney. This is awesome. I've just gotten 2 badges bought. This is crazy. Thank you
Dana,
so much.
Dana bought one of them. I love Dana. Dana is a very good friend of mine. So
oh my gosh. Well,
shout
I'm
out to
gonna
Dana.
follow Dana, because like this is awesome. This whole new badges thing, like woo, mind blown. This is awesome. This is so cool. So Sydney, there was a question actually from the relatable teacher that I think is totally pertinent. Let me scroll up. So what are some things classroom teachers can do to support their students with speech disorders? Now, I don't know if that's a loaded question. Do you want to tackle that? Do you want to share something with the group about that? I think that's probably a really good question, right?
That is a really good question. I think the biggest thing that teachers can do is when you're hearing like a kid is making an error, if you're able to kind of provide that appropriate model, that would totally be an appropriate time to kind of do so and helping that one kid. I think the other biggest thing that I would recommend for teachers is make the referral, right? So if you're hearing a kid and things
Right.
sound a little bit off, and you're like, oh, I'm not sure, just make the referral. You know, it's not going to hurt for the SLP to come and like maybe do a screen in the classroom, listen to them functionally, in class instruction and in like interactions with other kids. And then that is going to help for that kid to not kind of fall through the cracks. Because oftentimes what we see, as you know, is we have these kids that like they come and people are like, oh, I think it's okay. I think it's okay. I think it's okay. And then they pop up later on and they should have been an intervention.
Actually, that leads me to my last question, guys. We're coming to the end of this interview, and this was awesome. Awesome part 2. What are the top 3 indicators that you would recommend to a parent to come see someone like yourself?
Yeah, so the top indicators would be if your child has delayed with language. And so that's different than speech. Language is like using words, using them to communicate, understanding, following directions are all language-based things. That's the first one that I highly encourage parents. If you're around that 18-month mark and your kid still isn't making any type of first words, any sounds, definitely something that I would seek out a professional opinion on. So there's that one. The second thing is speech sounds. So that is how much they're understood by other people. By 2, we expect 50% for unfamiliar listeners. By 3, it's 75%. And by age 4, it's 100% intelligible to people that do not know your child walking on the street. So if your child is having difficulty, and not that you're having difficulty understanding them as the parent or caregiver, but other people are, I would definitely go seek out an evaluation then. And then the last thing, looking at our friends that are dyslexic, is come see an SLP if you're seeing that your child is having difficulty with rhyming. Ooh, it's
7:30. Don't worry. Actually, it's almost 8. It's cool. Rhyming.
Yeah, with rhyming. Yeah, so clearly with rhyming, with isolation of sound, blending sounds together, that's a good indicator to start. And like I said earlier, if your child has those delayed speech sounds, but also delayed language, that tends to be an indicator that we know for children that are dyslexic. Those are 2 things that we have seen trends with.
I love that. Sydney, I've got to say, like, this was amazing. And I also love the last thing you had said about, I think it was the second point, about 2 and 3 and 4. Those are things that parents may not know. And I know far too often we hear some folks that say, oh, no, we'll just wait. Or, it's so-and-so didn't talk until they were 3. And no, we need to look into that. Even if you're in a public school, like talk to the teacher, ask them their opinion. Even if you're in secondary, like obviously, hopefully your child's talking by the time they're in secondary school, but you know what I mean? It's just, we can't wait. As someone said, early indicators are huge. So I really appreciate you sharing those 3 top indicators for parents and teachers really to know when to seek advice from someone like yourself.
Yeah, absolutely.
So Sydney, do you have any last final thoughts before we conclude this amazing live?
No, I just want to tell everybody thank you for joining us and listening to me talk. I hope that everything was informative. And if you have any questions, please, please, please reach out, and I'd be more than happy to chat with you.
So Sydney, we have a request. We should make a post about these indicators as a reference. Ask and you shall receive.
Yeah. You got it.
Yes.
We'll be on that.
Boom. We got it. Well, listen, everyone, thank you so much for joining in wherever you are. Good evening, good morning, good afternoon. Thank you, thank you, thank you. And Sydney, we'll talk soon.
Absolutely. Bye. Thanks, guys.
Bye.